Uh, just kidding, just kidding. Michael Ye here to introduce our president, and I hope the slides are up. Yeah? Okay, I have the honor of introducing your president, our president, all y'all's president, Dr. Carmen Cecilia Solorzano Zelaya. And she was born in 1966 near Managua, Nicaragua. Here she is as an infant. She was born into a highly educated family. Here is her mother and my new friend, Elida Zelaya, who has a degree in sociology. Carmen has a big brother, Raul, a middle brother, Marcelo, and her mother prayed and prayed to have a girl, prayed to the Virgin Mary, and finally received this gift of a girl. But Carmen had to survive with two older brothers. How is that possible? What did she do? She survived by biting them. Okay? And your mom told me that this was such a problem that one day she had to teach you a lesson by biting you. And that fixed the problem. This is her father. I love this picture. Raul Solorzano, educated man. Went to Phillips Exeter Academy, MIT, educated civil engineer, soil scientist, and was responsible for many major infrastructure efforts in Nicaragua, including hydroelectric dams and bridges. What about childhood? So, Carmen was a really great athlete. She played fronton. What is fronton? It is a sport that originated in the Spain's Basque country, and it resembles racquetball. So that is not Carmen over there, but that's just what fronton looks like. It may as well have been Carmen because her mother tells me that she was very good, right? So another thing is her mother never learned directly about her accomplishments through Carmen. She had to learn it through other parents because Carmen would never say anything. So then other parents would say, oh, she's beating all the boys and things like that. So because Nicaragua is located on Central America's volcanic arc, it has these beautiful crater lakes. And you see here, it says Laguna Craterica de Chiloa. So these beautiful lakes. And she would participate in water sports like water skiing and swimming. Now, some of those lakes had sharks. So she was swimming with sharks. In retrospect, the best possible preparation for becoming a surgical chair. All right, what about adolescence? Carmen made the long journey from Nicaragua to Dayton, Ohio. And that's where she learned English. Her brothers went to other exotic locations such as Fargo, North Dakota, and Eureka, California. Incredible. In 1979, there was a revolution. And pictured here, you see below Daniel Ortega, pictured with Fidel Castro, the Sandinista takeover of the Somoza regime. So a lot of political instability. Thankfully, Carmen had family in Texas, in Houston, where she was able to take refuge for some time during that. Interestingly, Daniel Ortega is now the president of Nicaragua. What about high school? Carmen always loved pets. So many photos of her with dogs and other animals. She was the best student in her class. There she is, valedictorian. And on the right, 80s hair, baby. She survived 80s hair. All right, we begin the Florida years. So she started out at Miami-Dade Community College, and she worked a number of odd jobs, such as working at Pizza Hut. She transferred to the University of Florida at Gainesville. Subsequently, in 1989, she gained admission to medical school at the University of Florida, and that year, she faced a very difficult decision that I'm going to come back to at the end. She was a resident at the University of Florida. Thereafter, let's talk about Carmen's wife, Mary. Okay, they met in 1995. Mary was a nurse. You met Mary earlier, right, with Jad Abumrad, right here, remember? Telling stories about the cardiologists, those terrible cardiologists. So Mary was an RN, Carmen was a resident, and there was some early flirtation over eviscerations and ED thoracotomy. So there was some guy, you would open chests, and Carmen asked Mary to massage the heart, so clearly love was in the air. Now, you've met Mary, so you know that she's attractive, she's outgoing, she has an ebullient personality. She was very popular. A lot of guys liked Mary. So there were these bizarre love triangles, some cardiac surgeon named Mike, and just a lot of drama with that. And so when I was speaking with them, I asked what I believed was an innocent question, which is, how do you know if a lady's interested? Okay, and what I'm about to say is verbatim from Carmen. I sincerely hope I don't offend anyone. So I asked her, how do you know if a lady's interested? And Carmen looked very pensive, more thoughtful than I've ever seen her look. And she went, well, you gotta try to figure out which way someone is leaning. And thankfully, in Gainesville, Florida, there is one question you can ask which will give you the desired data. There is one gay bar in Gainesville, and you can ask. And if they like the university club, then you have actionable information. And indeed, Google knows what's up. Okay, if you look closely there, Google knows what's up. All right, and it's also reasonably priced, I might add. So one day, Carmen took a chance and asked Mary to dinner and a movie. What restaurant? Don't diss the bell. What movie? Oh yeah. That's a good movie. You won Best Picture. Yes. So who could possibly resist this enchanting seduction, right? Mary and Carmen have been together ever since, and they were married, as I mentioned, in 2019. All right. Who are her influences? Several. Doug Evans, right in front of me, from MD Anderson Time and Fellowship. Jeff Lee, and of course the famous George Buck Irvin III. You guys, we heard earlier that he passed away last year. Just a little aside, if you will allow, every time I think of George Irvin, I think of this paper, the presidential address from 25 years ago. Please raise your hand if you've ever used an intraoperative PTH assay. Aren't you interested in the history and its origins? So if you haven't read this article, Chasing Hormones, please, when you go home, please read it. Carmen loves education and fellows, and many of these people are in the audience today. Teresa Lee, Denise Carnero-Pla, of course, you're the program director. John Liu, Will Mendez, I saw him. Mark Snyder is here. Azad Jabaviev, Jennifer Cannon, Todd Byer, and of course, Nerys Nilubo, who does such a great job moderating the noon session today. The Vanderbilt years, from 2010 onward. Professor Naji Abumrad, here in the audience. She describes fondly his mentorship, his guidance. She's had several colleagues, James Broom, Colleen Kiernan, she is over there in the far corner, and I just met Dr. Baragamian, Naira Baragamian. So who could forget the 2015 Nashville AAES meeting? That night at Tootsie's was the biggest rager the AAES has ever seen, okay? That's Lubudi on the drums. Lubudi on the drums. All right, colleagues, thank you to all of you who sent in photos. There were an overwhelming number of photos. Here's the photo in the middle is kind of small, but it's important. That's Carmen with Latin American colleagues. I'm sorry I couldn't make it bigger. You see her with Dr. Basica, Janice, and Herb Chen in an exotic European location. The bottom left is a retreat we had in August, and of course, on the bottom right, you see where she was installed as president 1 year ago. Let's talk about life with Mary a little bit. Life with Mary is rich. It is full of adventure. Snowboarding, bike trips, international travel, and Mary and Carmen were kind to host an event at their home during the retreat last August, and I have to say, you can really feel the warmth in that household and what they've built. I think they make a beautiful couple, don't you? All right, here is your $1 million question, and no self-assessment CME is not available. Can anybody guess who this is? Take a second. This is Carmen's granddaughter. They still can't believe it. They're so quiet. All right, I'm going to take you back in time. Okay, remember that difficult decision in 1989? Tough moment. Carmen became pregnant. and she faced a decision as to whether or not to give that baby up for adoption. And that's what she did. And this baby is all grown up. This is Bobby, his fiancée Jenna, their daughter, Georgia Ray. And they became reunited in 2020. Carmen calls this her new family. I think it's a beautiful story. Okay, a special message from someone who really wanted to be here. Let's see if it works.
Surprise, Carmen. It's your mom. Your dad and I, we are so proud of you. I wanted to be present in some way today and to say that to you. And thankfully, a very nice person invited me to do so. Enjoy today and know that no matter where you are, we are with you. Our love.
So sweet. What a wonderful lady. So all of you know some aspect of the professional side of Carmen, and I wanted to give you a flavor of the personal side. It has been an unexpected joy for me to get to know you better, Carmen, this year, an unexpected joy. You have undoubtedly, you have achieved the zenith of stature in American surgery, and yet you are humble, you are gracious, you are grateful, and you are the type of leader we should all aspire to be. Ladies and gentlemen, your president, Dr. Carmen Solorzano.
Wow, that was amazing. Thank you very much, Michael. That was fun and kind. Okay, I'm gonna take a sip of water here to get started. So, I never expected or even imagined that I would be standing here in front of you today. What an immense honor it has been for me to serve this organization for about 20 years, and then have the privilege of serving as your president. Today, I want to share my reflections on the AAES, My Kindred Spirits. And yes, Dr. Pasica, I do have an outline. So first, thank you. What were the chances? Down memory lane. The AAES and its importance in my professional development and the care of my patients. And then I will talk a little bit about education, a core mission of the American Association of Endocrine Surgeons. I am fortunate to be here today, and this is how I feel. For of those to whom much is given, much is required. JFK. I was sitting at the AAES business meeting in Cleveland when this slide came up, and wow, you can imagine my surprise. Look at these friendly surgeons, mentors, sponsors that I have been looking up to for many years. They once again made me feel included. I know some of you are not present in this picture, but you are there in spirit. And also, look at how much gray hair is here too. So thank you, muchas gracias. I want to first thank the AAES members for the privilege of serving as your president. Thank you, Barb Miller. You probably had no idea what you were getting yourself into that day, that same day in Cleveland. The officers, council, for your guidance this year. To the past presidents, for leading by example. To the committee chairs and members for your ongoing volunteer work that makes this organization successful. To the program committee, to the pre-meeting course chairs and the local arrangements team. To AMR, Lauren, Emily, for your invaluable organizational support. To my parents, my role models, who pushed me to be the best I could be. To my mother, Elida, who you heard from, a sociologist that graduated from the Universidad Centroamericana de Nicaragua, who taught me to be passionate about what I believe in, and trust me, she is passionate, and to fight for it. To my late father, Raul, a civil engineer and MIT graduate, he helped build the first hydroelectric dam to bring electricity to remote areas in Nicaragua and Central America. He told me that we all can make a difference in our local environments, one small deed at a time. To my family, to my wife, Mary Peters, we met, as you heard, 27 years ago at the University of Florida, where she was a surgical nurse and I was a third-year resident. She has been the compass in my life. She's the most positive and joyful individual, and I know for sure my better half. Everybody tells me that. To my son, Bobby, and his fiancée, Jana, who you just met, thank you for making me a young grandma with Georgia Ray, pictured in the middle here, AKA Peach. To my brothers, who I did bite, Marcelo and Raul, I love you. Thank you to Najia Boomrad, who is here today, who saw something in me and hired me nearly 15 years ago at Vanderbilt University. He trusted me. He is a friend, a mentor, a sponsor, and my dad in the United States. Dr. Aboumrad practiced general surgery and endocrine surgery and was himself mentored by Pat Newman. Pat Newman, a prior leader of this organization, past president of the American College of Surgeons, and also the founder of the Association of Women Surgeons. Thank you to past trainees, many of whom are now dear friends of mine. Many are missing from this slide. It has been a privilege to participate in your training, and watching you succeed makes my job a joy. Thank you to the Vanderbilt Endocrine Surgery Group, Naira, Colleen, my practice partners, the nurses, the staff, and research collaborators. Our program is definitely excellent because of you. As you heard, I was born in 1966, so I was curious to see what was happening at that time. A gallon of gas was 32 cents, DNA was deciphered, the Soviets landed an unmanned craft, Luna 9, on the moon, while NASA had Lunar Orbiter 1 going around the moon, working towards JFK's goal of having a man on the moon. In addition, 1966 saw the birth of Star Trek, the original series, for those Trekkies in the audience, to boldly go where no woman has gone before. Good words to live by. So you heard some of this, but I was born in Managua, Nicaragua, the land of lakes and volcanoes. I was a tomboy, and I loved sports. So I distinctly remember being frustrated by not being allowed to play football, and the real football, not, you know. So I looked for alternatives, and I played fronton competitively, as you heard, and was the best I could be. I wondered early on, though, who makes these rules? And more importantly, how do we change them? During middle school, my abuelita, short Lita, died of metastatic breast cancer. She had been treated at the MD Anderson Hospital on a clinical trial of whole breast radiation in the 1960s. She later developed metastatic cancer to the lungs, and I admired the physicians that came to her house to treat her. So that became my why. I wanted to help people. I wanted to be a doctor. In 1979, I was 12 years of age. Nicaragua had a revolutionary war. I learned to appreciate a few things that were normally taken for granted. I saw human suffering, scarcity of necessity, and monetary devaluation. Toward the end of the war, my parents stayed in Nicaragua to help with their church. My two brothers and I were evacuated in a C-130, and I put a picture up here so you can see what that looked like. And we went to Panama, and from there, we came to the great state of Texas. I spent several months in Houston. I got to go to the Astrodome, and that was 1979. And I then returned to Nicaragua to finish high school. In 1985, I left Nicaragua to go to college here in the United States. So fast forward later, I wanted to be a surgeon. I heard, but you're a woman, you don't look like a surgeon, what about your husband, and how are you going to have a family? Lots of buts. But what were the chances that I would be standing here before you today? These are some of the demographics of medical students, residents, surgical faculty, compared to the US population. You can see among Hispanic, Latinos, Spanish origin students that are accepted to medical school, only 3.4% make it to be surgical faculty. Further, if we look at the breakdown of Latino medical students by gender, only 1.1% of Latina female medical students make it to US surgical faculty, much less professor, and I'm a Latina woman professor, chair of surgery. My chances of getting here today were very low, so I am thankful, and I need to pay it forward. I stand here before you as the first Latina woman president of the AAES. My first AAS meeting was in 2001. Barbara Kinder was president. I was a surgical oncology fellow. My mentors were Doug Evans, Jeff Lee, as you heard. I gave an oral presentation on non-functioning pancreatic neuroendocrine tumors. I had collected all that data by going down to the basement of the MD Anderson Hospital. And I sat there and I looked at all those charts. I had never seen a woman be president of a major surgical organization, and I immediately felt included. Since then, the AAES has played a large role in my surgical career. Please allow me to travel down memory lane and tell you how I got interested in endocrine neoplasms. Circa 1990, these surgeons inspired me. They told me that I could be a surgeon. Bland and Copeland just recently passed, and actually today is having a eulogy, and I'm missing it, but he would be proud. These were general surgeons who were experts in cancer surgery who trained at the MD Anderson Hospital. Do you see a theme here? They were both presidents of the American College of Surgeons and the SSO. Howard and Vogel were transplant and HPB surgeons, respectively. All of them performed endocrine surgery as part of their practice, and I admired them and I wanted to be like them. At the end of my residency, I decided for a surgical oncology fellowship. There were no endocrine surgery fellowships then. As a chief resident, I had won all the awards and I had great success in research. I told you I'm very competitive. My application to fellowship was very strong, but I did not match. You can imagine my disappointment and dismay. But this opened an opportunity to do translational research with a leading figure in angiogenesis, Dr. Isaiah Fidler. I then matched and graduated the clinical fellowship and acquired wonderful mentors who introduced me to the AAES and the Society of Surgical Oncology. I tell you this because life is not a straight line, and you can learn from adversity. Now, let's talk about the AAES and what it has done for my professional development and for the better of my patients. It never hurts to remember our history. the founding of the AAES. The time was right, endocrine discoveries were growing, and it was too much for the general surgeon to master. A group of visionaries got together in San Francisco at the IAES, Clark, Edis, Kaplan, Monchik, Thompson. The goal was to create an organization of surgeons who are dedicated to the advancement of the science and art of endocrine surgery and to maintain high standards in patient care. The first AAES meeting, yes, it was 1979 in San Francisco, but the actual first meeting organized was in 1980 at the University of Michigan, and Norm Thompson was the first president. And I quote, "Those present will remember the enthusiastic response of the kindred spirits. An immediate camaraderie developed that set the tone for this newly created group. And set the tone it did, because by the time I attended the AAES 20 years or so later, I found my kindred spirits." Last spring, I was fortunate enough to visit the University of Michigan, and Paul Gager took me to visit the site of the first AAES meeting. I stood there in the corner where the famous panel had sat, and I looked over to the green velour chairs that are still there. I also had a chance to visit Dr. Kaplan at the University of Chicago. He took me to the bookstore and bought me a University of Chicago hat. Thank you, Dr. Kaplan. And Orla Clark was right when he said, "We are the nice surgeons." So in the next few slides, please focus on the red square and the blue squares for the message. During fellowship, I learned that when you try new procedures, volume and record keeping is important. This group of surgeons, led by Drs. Hickey, Lee, Evans, all prior leaders of this organization, asked the question, in patients who present with bilateral FIOs, can we save the cortex? And what is the long-term results of this procedure? This is one of the first large series of cortical-sparing adrenalectomy for familial FIOs. A follow-up paper showed that 65% of patients could be steroid-free with low incidence of recurrence and no metastases. During the discussions at the AAES, you can learn about diseases and share ideas about what additional research is needed to advance the science of endocrine surgery. During fellowship, I also learned about the principles of cancer care. This group of surgeons asked, why are we waiting to stage the neck lymph nodes until after removing the primary? Why not look for the lymph nodes before the thyroidectomy? This seems obvious today, but it was not then. This paper was presented at the AAES by my good friend, Maria Kuvaraki, who I sat next to in my fellowship. This was in 2003. This paper generated or told us that 39% of patients had non-palpable abnormal lymph nodes on preoperative ultrasound. The operative plan needed to change, and it needed to occur before the resection, at the time of the resection of the primary. There was a robust discussion. Some commented that this was a occult disease. Others said, no, this is not a occult disease. If the endocrinologist finds it later and calls you to go get it out. At the AAES, you can challenge the status quo with cancer principles. Necessity is the mother of invention. Dr. Irvin, prior president and Oliver Cope Award recipient of the AAES, decided to cook up a quick PTH assay to guide parathyroidectomy. Dr. Irvin had just failed a parathyroid operation on the charge nurse of the University of Miami operating room, Rita Martin. He began to measure the PTH in the operating room using a quick radioactive assay and presented his findings at the AAES in 1993 and beyond. The use of rapid PTH assay predicted postoperative calcium, and there was no need to look at all the glands. I was fortunate enough to learn so much from George Irvin and Denise Carnero, who ran the PTH machine in the operating room. He used to call me the Texas cowboy. I can tell you why later. Irvin told me the story that the ambulatory parathyroidectomy paper was rejected so many times, but he persisted until Cloud Organ accepted it in Archives of Surgery. The discussions about intraoperative PTH have been very intense at the AAS. At the AAS, you are encouraged to think outside the box. When I started as junior faculty at the University of Miami, I was no longer in the country of Texas, where it was easy to get ultrasounds, FNAs, and things easily. I was getting all these patients with non-palpable nodules and poor ultrasounds and also persistent thyroid cancer. So we started doing our own ultrasound, and we called it surgeon-performed ultrasound. Denise taught me everything I know about it, and biopsies in the clinic. Several of my first papers were rejected, but I kept submitting until they got published. Surgeon-performed ultrasound can be used to localize the parathyroid, guide biopsy, detect lymph nodes, and look at the vocal cords. It's an extension of the physical examination, and now is back in popularity to guide RFA, so folks are flocking to learn it. At the AAES, you can be resourceful and can collaborate with others. This group of surgeons asked, is there an imaging modality that surgeons can read and with improved sensitivity to detect abnormal parathyroids? Yes, you can modify a CT angio and call it 4-dimensional CT. This test is easier to read than a sestamibi, which takes time to learn and interpret. I think the younger generation of endocrine surgeons prefer 4-dimensional CT. At the AAES, you can adapt. Regarding lobectomy versus total thyroidectomy, you heard Asha come to the microphone. This is a famous quote from Blake Cady, past president of the AAS and the SSO. In no other human cancer with 99% 20-year survival rate is a policy of routine total primary organ removal practice, nor routine local adjuvant and systemic therapy utilized. Biology is king, selection is queen, and the technical procedures are princes and princesses of the realm who are trying to overthrow biology. Think again. De-escalating care for low-risk thyroid cancer. This topic has been debated for years at the AAES. In properly selected patients, partial thyroidectomy has the same survival with low risk of recurrence. At the AAES, you can debate for decades and help change practice slowly with data. Think again and again. What about surgery at all? Not at all. We could just follow patients with low-risk papillary thyroid microcarcinoma. Yes, in properly selected patients, active surveillance has excellent oncologic and quality outcomes. At the AAES, you can meet and learn from innovative and famous endocrine surgeons like Dr. Miyauchi, who is actually in the audience. Circa 2008, a general surgery resident was frustrated with how difficult it was to identify parathyroids, so she looked for another way. The parathyroid has autofluorescence under near-infrared light, and parathyroid detection can be enhanced. Vascular assessment remains a challenge. The pace of new technology advances has increased, and we must figure out whether it helps our patients. Discussions have been both enthusiastic and skeptical, and at the AAES, you can invent things and evaluate new technology. So the AAES has allowed me to grow professionally and remain up to date on the art and science of endocrine surgery, so I can take better care of my patients. When you submit your best work, the discussion that will generate more ideas, and we advance the science. So please submit your best work to the AAES. In addition to what I just mentioned, I wrote down a few things that have happened since I finished training. Introduction of new technology, nerve monitoring, energy, NIR devices, AI, the uptake and modification of minimally invasive adrenalectomy. I had to learn the retroperitoneal approach. I did that in 2010, and I then switched to the robotic approach in 2014. We also saw the introduction of the Bethesda system, molecular testing, scarless thyroid surgery, targeted and ablation therapies, and active surveillance. The challenge, so much to learn, so little time, and with a predicted shortage of general surgeons, which can lead to less access. I like this quote, Charles Darwin. "It is not the strongest of species that survives, nor the most intelligent. It is the one that is most adaptable to change, that lives within the means available and works cooperatively against common threats." Next, I want to highlight education, which is a core mission of the AAES. When faced with challenges, I always go back to my why. Our why is to advance the science and art of endocrine surgery. I believe our why is the community we serve, and the patient is in the center of that community. The how is by educating the next generation of general surgeons and promoting the professional growth of our members. To do this, we also need to fund our mission. Thank you to the AAES Foundation. By the work of leaders of this organization and its members, the AAES has transformed endocrine surgery education for the better. How? By placing endocrine surgeons in major surgical departments, by creating curriculum, by accrediting fellowships, by providing postgraduate courses, by writing clinical guidelines, providing research funding, advocating for patient education, helping our surgeons keep record of their outcomes by SESQUIP, and promoting leadership education. Desperately seeking surgeons. In this AAMC publication, which is already outdated, we see that supply of surgeons is not keeping up with demand. This is a complex problem with not enough resident spots, burnout, retirement, boomers, and many other reasons. Career satisfaction and skill are crucial to maintaining a healthy workforce. By 2034, we could be short 30,000 surgeons, and a large percentage may be general surgeons. In his presidential address at a fun city named Nashville, Jerry Doherty discussed that surgeons are not easy to replace and are in high demand. Access to care requires broadly trained surgeons, and we need to educate and support general surgeons who perform quality endocrine surgery. I completely agree. For many years, I practiced surgical oncology, general surgery, as well as endocrine surgery. This has been extremely rewarding for me. I have asked trainees who are thinking of doing endocrine surgery and then they decide differently why they change their mind. Some say it may limit their opportunities for jobs. We need to educate and support surgeons with broad practice who also perform quality endocrine surgery. This training can occur during residency, perhaps with flexible time, or during fellowship, or in early faculty years, like Mastery General Surgery program by the American College of Surgeons. So education of surgeons changes constantly. And are we ready for competency-based education and EPAs? Are we influencing endocrine surgery education at all levels? What are the gaps in fellowship training? Is the training and education of endocrine surgeons changing outcome? What is quality in endocrine surgery? I know Dr. Sippel has great interest in this last question and will work on answering this during her presidency. During the AAES leadership retreat, we decided to create a new task force. We named it the Education Readiness Task Force. Chaired by Dr. Lindemann and Hughes, it has an overarching goal of integrating the AAS efforts in education while maintaining our influence in endocrine surgery education across disciplines and moving towards competency-based education. These efforts will be at the student, resident, fellow, and practicing surgeon level. Drs. Fingeret, Lindemann, Kuo, Hughes, and Wang will lead the efforts with short and long-term goals. So please attend the presidential lunch session tomorrow. This is titled on the state of affairs and the future of endocrine surgery education. To learn more about the Education Readiness Task Force and the initiatives, and listen to our featured speakers, including ACS President-elect Dr. Beth Sutton. A goal of the new task force is to continue our influence in endocrine surgery education. And to that end, we created a formal relationship with SCORE, a major provider of surgical education. We are working with Dr. Joshi, Editor-in-Chief, Dr. Perrier, editor of SCORE 2 curriculum, which will provide education at the fellowship and perhaps practicing surgeon level. Dr. Morris Weissman, who edits the resident curriculum in SCORE. SCORE could be used by our fellows towards competency-based education. It can be a potential source of education for those who seek focused practice designation. For years, the AAS members have created didactic content for the American College of Surgeons. Under the leadership of Drs. K. Baker and Miller, the process of submitting this content has been formalized. We hope that all our members participate so we can put up our best material. This has been met with great success, with several sessions selected for the Clinical Congress 24. Many AAS members have also participated in the creation of the operative standards in cancer surgery, and now are working on dissemination of that content. Part of our continuing influence in education is collaborating with societies that participate in endocrine surgery education. So we are now working closely with ENDO and SSO to increase educational programming and international outreach. We are also improving communication with the CGSO board so that they include qualified AEES members. Under the leadership of Drs. Carnero Pla and Velasquez, the Pan American Task Force and the AAS Foundation provided travel awards for Latin American surgeons to attend this annual meeting. And this has now been endowed and will be called the Solorzano Travel Award. This year, UT Southwestern and MUSC are hosting observational opportunities to increase our interaction with our Pan American colleagues. The AAS has also begun to co-sponsor surgical meetings and courses in Latin America. We started in Mexico, Brazil, and we have plans for more, with several AAS members serving as faculty with the goal of increasing our visibility, membership, and disseminating best endocrine practices in the Americas. Kudos to Denise and David for a job well done. There's one thing that I have learned too, and this is off the script, is observing other surgeons. I have learned so much, and I can change what I do, or I wish I had more time to do so. These are the current demographics of the AAES. 40% of active members are now women. The AAES continues to make progress as an inclusive society. When compared to a report by Dr. Kuo in 2019, diversity in the AAS has improved for all groups. Hispanics, Latinos, African American members remain underrepresented compared to the general population. Opportunity exists to further improve our diversity towards inclusive excellence. The endocrine surgery identity and DEI committees are working together to attract a more diverse group of applicants to look at endocrine surgery as a career. Doctors Kushner and Zhang, pictured here, are busy attending the medical student program at the American College of Surgeons. We must identify recruitment barriers and try to partner with programs with higher density of URM and rural trainees and expose them to endocrine surgery. I want to emphasize the importance of these committees here in playing a part in our educational mission. This year, there was a lot of work on transitioning to a new site, patient education, webinars, revision of educational material. So thank you to Dr. Schneider, Livitz, K-Bakers, and the committee members that they lead. I want to emphasize the AAS also needs to continue to provide leadership education and mentoring for the next generation of leaders in our profession. The leadership course led by Drs. Chen and Sturgeon last year was greatly received. The REMAP program, led by Dr. Patel and others, has also been greatly received. Dr. Sugg and the Career and Leadership Committee have worked hard to create mentorship and leadership opportunities for our members. Dr. Tony Beninato just visited Vanderbilt as the AAS visiting professor and gave a great grand rounds. She also visited the operating room. As a result, I got to know her better. I know that I have benefited tremendously from the friendships, mentorship, and sponsorship in this society. Here, you see Herb mentoring me on the number and the color of rhino pins that I should acquire. I want to mention focused practice designation for adult complex thyroid and parathyroid surgery. A lot of work has gone into FPD by many prior leaders of this organization. The designation will recognize diplomats of the ABS and ABOHNS boards who have focused their practice in thyroid and parathyroid surgery. It will set minimum standards. The AAS should be the leading source of education and professional development for these surgeons. Lastly, during the summer retreat, the question came up of what is quality in endocrine surgery? How do we measure it? How do we teach it? How do we practice it? This generated 2 statement papers that will be featured in surgery soon. Dr. Sippel will be leading in this space during her upcoming presidency. I finally have come to the end of my talk, but I want to remind you that the AAS needs you. The AAS is nothing without you. This quote is from Mother Teresa. Each of us alone cannot change the world, but we can cast a stone across the waters to create many ripples. Going back to what my father told me, we all can make a difference in our local environment, one deed at a time. I want to thank the leadership of this organization pictured here. As I see all these members of the leadership, I think that the future is bright. And here is just a snapshot of my kindred spirits. If you're not in the picture, you are there in spirit. Here you can see Janice's Festschrift. I have never attended one done for a woman, and it takes great courage. I cherish all the times that I have spent with my endocrine friends, and I want to point out that I continue to learn from you. See the yellow arrow? And you can see here how I still need guidance, and Herb is happy to provide it. So in conclusion, to boldly go where few have gone before, you need to believe in yourself, have support, mentors, and sponsors. The AAES must continue to be a hub for education and professional development to our members. Including all helps all. The AAES needs you to continue its mission. And thank you so much.
That was so good. So authentic, exactly what we would expect. Congratulations. I'm going to quote somebody very influential from earlier today who said, "You did not disappoint." I will say I was looking at pictures about a year ago after you became president-elect, and so all the pictures from the previous meetings are on the website, you can find them. And I saw one from Durham in 2018, and it's a picture of Carmen and Tracy Wang walking down the hallway, and Carmen is like this, and they are moving somewhere, and I said, oh my gosh, we are gonna go somewhere this year. And that is exactly what we've done. Your leadership, your vision, your service, I mean, truly, she does not phone it in. She is working every week, and some days I didn't think I could keep up. So we were running, I had my running shoes on, right? And, but really what you've put in play for us, your vision for not just this year, but the future, to make AAES a stronger organization is just absolutely fantastic. Through the Education Task Force, there's so much important work being done by so many people that will continue on into the future, along with the Travel Award and many other things, formalizing relationships, so important. So I just want to say thank you on behalf of all of the officers and the membership. So we have some gifts for you. This is the fun part. Okay, so this is the first one. So you will, you can, but I'm going to show what it is. So you can, if you want to open it, open it. Absolutely, no, you should. You should, because, yeah, okay.
I'll wait.
All right. So you will always be an ambassador for our organization. So we want you to have something to show off the AAES. So we had you made a custom-made, one-of-a-kind AAES vest. On the inside pocket, it has your presidential year, 2023, 2024. So you will always have that. I know that you like to walk around campus, so you can talk all about the AAES. We also, I wanted to help you remember your time in Dallas, specifically. So we had you, and unfortunately they're not finished yet, but we made you a custom pair of Spurs. So let's say AAES President 2023-2024 on them. They will be shipped to you, and you can, mainly they're for your desk or your bookshelf, but really what I'd like to see is you wearing them in the operating room. So if you can get us a picture of that, that would be great. And I have one more gift for you. If you'll come over to the table, because I want you to open this.
Wow.
I think this is a very appropriate gift for a president as well as a surgeon, because if you pick it up, who doesn't need a gigantic knife? This is a champagne saber, and it is engraved with AAES President Carmen Solorzano 2023-2024. So I think right now, Lauren Santangelo from our management company is probably having chest pain because she's thinking about the liability of a giant knife in the hands of, thankfully, a very good surgeon. So I don't know if, things may get a little crazy tonight, or at the gala, so we may have to get a bottle of champagne and pop that cork off, so.
I'm pretty good with a machete, and this is pretty close. Yeah.
So thank you, Carmen. Congratulations again. So.
That was awesome. Thank you. Very thoughtful.
All right, now I'm going to go back to some secretarial duties. I'm the only thing standing between you and the presidential reception, so I'll try to be brief. Please do join us for the President's reception. That is going to be located just outside the room in the foyer. The notes here say, and the patio if it's nice. So you can go out there. I don't think either one of us will be out there, but okay. We are also excited to welcome, at the President's request, a mariachi band performance from the Booker T. Washington High School for the Performing and Visual Arts. Previous graduates of this school include Norah Jones and Dua Lipa, so this should be a real treat. So please enjoy. You could be actually watching the next superstar. And then light appetizers are provided, so groups can arrange dinner following the reception. I know a lot of us have fellow dinners. Use the green drink ticket at the bar. You can also purchase additional drinks, and we did make sure that the margaritas you can actually get with your green ticket. You don't have to buy those separately. And then tomorrow morning we begin at 7 a.m. With the first scientific session, followed by the MCW Stuart Wilson historical lecture from Dr. Janice Pasica. So that should be awesome. And then breakfast is also available starting at 7 a.m. tomorrow. So everybody have a great time.